Hello, everyone. My name is Cherie Blair, and I'm with the Department of Medicine, Division of Infectious Diseases at UCLA. I will be presenting a poster from our CHIPTS 2021 Kickstarter grant entitled HIV, Methamphetamine Use, and Pulmonary Hypertension, From Blue Skies to an Integrated Research Agenda. This poster describes the main findings from a joint UCLA-Stanford University symposium that took place on October 20th, 2021. In this symposium, we reviewed and developed a collective research agenda to address overlapping issues and unanswered questions surrounding methamphetamine use, HIV, and pulmonary hypertension. Thank you so much, and I look forward to seeing you in our breakout room.
Hi, everybody. Our names are Ashani Choksi, Christoph Zembruski, Ekram Setankaya, Soraya Millar, and Nishan Raman. We're a couple of second-year medical students here at Rowan University School of Osteopathic Medicine in Stroudsburg, New Jersey. And we are here to present our research project that studied the risk factors for HIV progression amongst males ages 18 to 35 in Essex County, New Jersey. So what we did was we queried the PubMed database for any articles that reported risk factors that influence HIV progression. So this included things like geographic location, poverty and income, level of education, social support, sexual engagement, depression, and coping skills. And what we found was that higher rates of poverty, lower income, lower level of education, presence of depressive symptoms, and sexual engagement with MSM were all associated with increased rates of HIV progression. So we invite you to listen to our presentation and come with any questions that you might have. Thank you so much.
Hello, everyone. My name is Amaro Del Pino. I'm an associate professor at Charles R. Drew University of Medicine and Science and a health research scientist at the VA. We partnered with St. John's Well Child and Family Center to conduct this project, engaging the siblings of Latinx MSM and promoting PrEP use. This is a really exciting project because we hear a lot of research about how family rejection leads to negative health outcomes in our communities. But what's often missing from the conversation is that families reconcile and the families are a great source of social support. So in this project, we interviewed Latinx MSM with a brother or sister that they trusted. And we found that their siblings are more than willing to support PrEP use. And more importantly, some of them are also willing to take PrEP themselves if this would help their gay brother get on PrEP. So we look forward to you joining us in breakout room 3 to have a wonderful conversation.
Hello, attendees. We are pleased to present our poster at the 2022 CHIPS Next Generation Conference. I'm Gabriel Edwards, Assistant Project Scientist in the David Geffen School of Medicine here at UCLA, and a member of the CHIPS Policy Impact Corps.
And I'm Carolyn Belton, CHIPS CAP member, and I work directly under the Medical Care Coordination Program as a patient care manager at AIDS Healthcare Foundation. The title of our poster is Services for Reentry Populations, Community-Focused Development of a Policy Brief.
Our poster describes how a group of academics and community members developed a policy brief in support of an LA County effort to strengthen alternatives to incarceration. Specifically, the group focused on a recommendation to improve community services during reentry from incarceration.
We hope to see you in our breakout room.
Good morning, afternoon, or evening, depending on where you're watching this. I'm Kevin Frost, the Director of External Affairs with Harm Reduction Los Angeles, or HRLA for short. I will be presenting this project alongside the co-directors of HRLA, Tucker Avra and Sid Ganesh, with special support from Dr. David Goodman-Meza and the gracious funding of CHIPS. Our poster is titled, The First Annual Harm Reduction in Clinical Praxis CME Conference. This poster reflects the work from HRLA's inaugural Harm Reduction in Clinical Praxis Symposium, an event intended to open up discourses on improving the treatment of people who use drugs within medical spaces. Please don't hesitate to come by our breakout room and speak with us about this work. We're extremely excited to discuss some of the insights shared at this conference and can't wait to hear everyone's thoughts. Thank you so much.
Hello, my name is Caleb Garcia, and I serve as the co-executive director of the HIV Counseling and Testing Coalition at UCLA. With the gracious support of the CHIPS Kickstart grant, HCAT was able to host its first ever sexual health and wellness fair in person and on campus at UCLA. The purpose of this fair was to provide students, staff, and faculty an opportunity to get free HIV testing and also associated risk reduction counseling. It was our first opportunity in a very long time due to the pandemic to do so on campus. But the fair also provided an opportunity for HCAT to further expand our reach on campus and also collaborate with other campus-based organizations and initiatives in hopes to build a safer, healthier, and more sex-positive campus. If you'd like to learn more about the Sexual Health and Wellness Fair or HCAT in general, we'd be happy to share and answer any questions in the breakout room. Thank you.
Hello, my name is Bill Van Lee from APLA Health in Los Angeles, California, in collaboration with Ian A. Klinger and Matt G. Muchler from Cal State University, Dominguez Hills, and RAND Corporation, presenting innovative outreach strategies for a PrEP study during COVID-19. This study explored in-person, virtual, and hybrid strategies to increase outreach and recruitment for a PrEP study during the COVID-19 pandemic. I invite you to join the breakout session and welcome any questions. Thank you so much for your time.
Greetings. My name is Charles McWells, and I am an HIV Prevention Services Manager at the Los Angeles Centers for Alcohol and Drug Abuse. The title of my research project is Velvet Jesus, an edutainment model for behavioral change among at-risk LGBTQ adults of color. My research focuses on the creation of a motion picture that focuses on homophobia, substance use, and mental health disorders as themes in the plot. The film is being screened for at-risk LGBTQ individuals, and after each screening, those individuals discuss whether the film made them consider behavior change of some of their own life experiences. I want to take a moment to thank you for viewing my poster presentation and for listening to this introduction.
Hello, everyone. My name is Diana Polanco. I am a research coordinator for the UCLA Semel Institute Center for Community Health. My poster is titled, Do Chatbots Have a Place in Adolescent HIV Research? A Qualitative Study in Los Angeles and New Orleans. The purpose of this research was to assess the feasibility of using chatbots in HIV research. Focus groups were held to discuss people's experiences interacting with chatbots, as well as to discuss the pros and cons and what role chatbots could play in HIV research. I look forward to seeing all of you in my breakout room. Have a great day.
Hi everyone, my name is Rebecca Reese, pronouns she, hers, and I am the HIV Project Empowerment Trainer for Ultimate Health Services. And I'd like to share with you our findings from our Get PrEP provider trainings. We develop a curriculum as part of a quality improvement project to train PCPs on PrEP and PEP within an FQHC serving underserved communities in Southern California. A pre- and post-training survey and knowledge assessment were given to participants who attended the training. A total of 117 participants completed the pre-training survey and 84 participants completed the post-training survey. After the training, the percentage of providers that rated their knowledge on PrEP as good or excellent increased from 38.2% to 83.1%, and their knowledge on PEP as good or excellent increased from 33.3% to 83.1%. Participants' knowledge assessment scores increased from an average of 11 to an average of 18 out of 20. Our findings showed that education on PrEP and PEP, LGBTQ topics, and sexual health significantly increased both self-reported and tested PrEP and PEP knowledge among PCPs in a large FQHC setting.
Hello and welcome to the 2021 CHIPTS HIV Next Generation Conference. My name is Jimena Sandoval and I'm here with Dr. Ricardo Lepe, Dr. Ronald Brooks, and Mr. Brendan O'Connell. We're here from Bienestar Human Services and we're here to present our study titled Homeless Not Hopeless, the Impact of Support Systems in Improving the Quality of Life of Transgender Persons Experiencing Homelessness. As overview, in this study, we examine the extent to which social support connections impact trans persons' health risks, such as violence and HIV status. Join us in our break rooms to learn how we conducted this work, the results, and future directions. Thank you.